In a busy world where someone's always vying for your attention, we recognize the significance of this opportunity to speak with you about an important social issue. Thank you for considering our cause and for spending your cherished time with us. As we begin, please try to imagine being a person experiencing homelessness who wants nothing more than to climb out of poverty and to secure a safe and stable home. Now envision coming to the realization that the available services require transportation that is not available to you, placing change just beyond your reach. It would undoubtedly be easy to become discouraged and to lose hope. Few social problems are as visible as homelessness. It's becoming increasingly difficult for citizens to turn their head and to deny the existence of those who do not have a permanent place of residence. So, beyond the Hollywood depiction of people sleeping on park benches covered with newspapers, what does it really mean to be homeless? The federal government considers individuals or families to be homeless, houseless, unhoused, or unsheltered if they lack a fixed, regular, and adequate nighttime residence, reside in a public or private residence that's not designed or intended to be a regular sleeping accommodation for human beings, or who sleep in a publicly or privately operated shelter that is intended to be temporary. This includes congregate shelters, temporary transitional housing, hotels or motels paid for by charitable organizations, and moving from one home to another looking for accommodations for even just a few days. We often hear this referred to as doubled up or couch surfing. Every age, race and ethnicity, mental and physical health status, and sexual orientation is represented in the unhoused community. These include both single adults and families, children of all ages, senior citizens with a low fixed income facing rising costs, veterans who have served in our military, runaway or abandoned youth at risk for trafficking and exploitation, and those with physical or mental health concerns. LGBTQ plus youth are more than twice as likely to become unhoused than other young people, and young Black and Hispanic individuals are more likely to experience homelessness at rates of 83% and 33%, respectively. One of the common misconceptions regarding the unhoused population is that they're unemployed and they're not willing to work. Quite the contrary, the United States Interagency Council on Homelessness reports that 40 to 60% of these individuals do sustain unemployment despite the many obstacles faced. A startling 650,104 individuals and families experienced homelessness in the United States in 2023. This is a record high and represents a 12% increase over just 1 year prior. Closer to home, on any given night in Missouri, 6,527 individuals do not have a place to call home. It's easy to think this doesn't impact us as we're perceive these people to be in large urban areas with a multitude of resources far removed from our small town lives. However, if we look at our own small community, we can see that this social problem plagues rural areas as well. During the January 2024 point in time count, on one of the most frigid nights of the year, individuals combed the community and manually counted those who were unsheltered. In Marshall, Missouri, population 13,622, 38 individuals and families were observed to be in a nighttime residence classified as a public place not meant for human habitation. This included sleeping in vehicles, parks, abandoned buildings, parking lots, and under overpasses. This number does not include each individual person, as families count as one unit and can represent multiple individuals. It also does not include those who are doubled up in crisis with family or friends or couch surfing from home to home. This statistics also does not represent those who are sheltered in temporary housing in other communities or utilizing hotel vouchers from local charities. To further illustrate the extent of the problem, in a school district of just 2,500 students, 205 of those are registered as unhoused. That is 8.2% of the community's school-age children. When compared with Columbia Public Schools just 60 miles away, which sits at 2.5%, this is quite significant. When we consider that it's unlikely that all the unhoused were observed during the point in time count, or that all of those without housing come forward and risk scrutiny or potentially trigger involvement from child welfare services, the actual numbers are probably much higher. We're fortunate to have partners down in the service trenches who recognize the great need. Marshall Housing Authority has limited public housing available with a long waiting list. The demand far exceeds the supply, and referrals must be made to emergency shelters and other communities requiring the family to travel. This requires those willing and able to relocate from their home community to find a way to get to the closest resources 30 to 45 miles away. Our law enforcement partners observe this social issue firsthand and are eager to help us address it. They'll refer to the Way Home for transportation services to ensure families can make it to the food pantry or to the healthcare area of town. Missouri Valley Community Action Agency receives an average of 5 to 10 calls and walk-ins each day inquiring about safe living options for the unsheltered. They have funds to assist with utilities and recently received funds from the United Way to help people maintain homes, but do not have services specific to homelessness. State agencies often see families during times of struggle and crisis and are painfully aware of the hardship it causes to come to their offices on the outskirts of town and to travel to obtain the documents needed to apply for benefits. Hotlines are called in on families who are doubled up and tripled up in small homes or living in uninhabitable areas, giving them a front row view of the multitude of unhoused families locally. There are food stamp benefits available through the Family Support Division should the family be able to get to one of the grocery stores in town. Each is away from residential areas and one is across a major highway. Saline County Health Department, Fitzgibbon Memorial Hospital, and all physicians' offices are at the furthest point south in Marshall. The providers come in frequent contact with those who are unhoused and see their great difficulty receiving healthcare services. The community is equipped to meet medical and mental health needs, but only if patients can get to their facilities. There are over 30 churches in the area that strive to serve all members of our community. Several have on-site food pantries, one of which is a drive-up food pantry. Marshall Public Schools is often the first agency to become aware of the need for housing and the barriers to obtaining it. They can and do make referrals for services that could enable a family to change their housing status. However, the families cannot always access them. Missouri Valley College has a nonprofit management program that is equipping the next generation of change makers. Through their service in the community, they encounter individuals searching for a home. They will not only refer those in need, but will partner with us for an internship program. Powerhouse Community Development Corporation assists families in many ways. However, they cannot physically transport to and from their resource center, where they have household goods and other items to help obtain and sustain housing. They provide educational programming, parenting courses, and nutritional courses if the individuals are able to attend. Community donors and volunteers are crucial to our mission. Some will donate their time and energy, and some will donate funds. Many will do both to partner with us in creating change. Some gaps in service were easy to see in the previous slide. There are food pantries, but they require a way to get to them, and the largest one involves being in a vehicle in line for up to 2 hours, sometimes more. How do families on foot get a substantial number of groceries to where they're staying? There are food stamp benefits available to low-income families. However, they often need to go into the office with documents to obtain these benefits. For example, if a family enters the office and they need a copy of birth certificates, this requires a 6-mile round trip walk to the Saline County Health Department on a very busy highway. While that doesn't seem impossible for a healthy single person, imagine completing this task in the cold with children in tow or with chronic pain, advanced age, or disability. There's a coalition formed to address the need for a shelter in the community. However, until that's completed, those seeking shelter services must travel to other communities, the closest of which is 30 miles away, and that's assuming there's space for them there. There are no services available to get them there, and the coalition does not intend to provide any type of transportation. A national study funded by the FTA reported that Missouri's transportation investment has continually declined for the last 24 years. This lack in funding exponentially affects services operating in a smaller rural community such as ours. Rural hours of operation are very limited, and sometimes transportation does not run for weeks at a time. A 3 to 5 day notice is required with no same day or next day service. Non-medical trips, including job searches and interviews, mandatory drug testing to begin a position, obtaining needed items, signing up for housing or food stamp benefits, obtaining birth certificates for social security cards, attending school meetings, or responding to emergencies for your children are certainly necessities. However, there are no resources for this. The non-medical transportation that is available is high cost, think Uber, or is not dependable and requires weeks of pre-planning. This requires more forethought and financial stability than it is a reasonable expectation among the population experiencing homelessness. Transportation disadvantage disproportionately affects the unhoused population and negatively impacts access to employment opportunities, education, healthcare, and social services. Research has confirmed that a lack of transportation has more impact on the ability to climb out of poverty than crime, childhood test scores, or the number of two-parent households in the population, all factors commonly correlated with social and economic mobility. Simply put, it doesn't matter how many resources well-meaning members of society create if they're not accessible. If unhoused individuals cannot meet healthcare needs, respond to a request for a job interview, visit a food pantry, or connect with other services necessary to lead them away from poverty, there's no likelihood for an upward social and economic trajectory.
In the heart of every rural area lies a community often overlooked, yet deeply intertwined with the fabric of life, the unhoused population. Among the myriad challenges they face daily, one critical barrier stands out: access to reliable transportation. Individuals experiencing homelessness navigate a complex landscape of limited resources and opportunities. For many, securing transportation is not merely a convenience, but a lifeline, a pathway to medical services, employment opportunities, and connections with loved ones. Yet, it remains an elusive necessity, hindering their journey towards stability and self-sufficiency. For these individuals, transportation is not merely a means of getting from point A to point B, but this lifeline connecting them to services and opportunities and the possibility of a better future. At the Way Home, we stand at the forefront of change, driven by a simple yet powerful vision to help these individuals to bridge the gap between homelessness and transportation accessibility in the rural area of Marshall, Missouri. Our mission is clear. The Way Home is dedicated to ensuring that each person has access to resources by providing transportation to the unhoused individuals in our community. In doing so, we seek to restore hope and dignity to those experiencing homelessness. We arrived at this mission because we firmly believe that every unhoused individual is deserving of dignity and respect, sometimes stripped away by other members of society and structural policies. Our vision is a community in which each person has access to the resources required to secure safe and appropriate housing, empowering them to exit the state of homelessness. We arrived at this vision because helping unhoused individuals exit the state of homelessness is not only a matter of compassion and human rights, but also has tangible benefits for individuals, communities, and society as a whole. Every person deserves access to basic needs such as shelter and health care. We want to help unhoused individuals access necessary resources in the hopes that we can slowly help them break the cycles of poverty and work towards economic stability. As an organization of social workers, we abide by the NASW Code of Ethics. The code urges social workers to take action against oppression and discrimination. This is why advocacy is important to us. By advocating for policies that dismantle structures that criminalize homelessness, we can help create a more supportive environment for unhoused individuals to rebuild their lives. Additionally, the value of dignity and worth of the person in the code is an essential value for us because all individuals are deserving of dignity and respect. This forms the baseline for our value of respect. We also take a strength-based approach in that we want to foster an inclusive environment that values the unique strengths and potential of each person. Community engagement is also important to us as we aim to create a lasting impact on our community and want to create a sense of shared responsibility to promote a collective effort to address homelessness. Collaboration is also essential in community engagement, mobilization, and advocacy because relationships are the foundational building blocks of social work, and we believe forging connections in the community will maximize impact and move us closer to our goals. Our value of compassion highlights the need to show empathy towards unhoused individuals and approach each situation with care and understanding. Simple acts of compassion can go a long way in fostering understanding, building trust and rapport, and enhancing motivation for positive change. Finally, we strive to provide individuals with the tools that aid their journey in obtaining housing and needed services. Improved quality of life is important to us because we aim to help unhoused individuals exit the state of homelessness and advocate for systemic changes that address the root causes of homelessness. Here we have a force field analysis for the way home. Our proposed change is to implement a new, affordable, and accessible transportation service specifically tailored to meet the needs of unhoused individuals in rural Missouri. The force field analysis is used to identify and analyze the forces that drive or hinder our proposed change. The goal is to strengthen the forces for change and weaken the restraining forces to facilitate successful change implementation. Our first force resisting change is the criminalization of homelessness and stigma. Criminalization of homelessness refers to policies that treat homelessness as a criminal offense. While these policies vary across the U.S., the underlying stigma against the unhoused and not in my backyard poses a threat to our organization. To combat the criminalization of homelessness and stigma, the Way Home will actively engage in community mobilization and advocacy. We will partner with various community agencies, including 30 local churches, Marshall Public Schools, and Missouri Children's Division to raise awareness. Additionally, to mobilize the community, we will present to the Buckner Foundation, Missouri Valley College alumni gatherings, United Way, among others. Finally, we are committed to fighting for social justice. We will advocate for the unhoused by opposing efforts to criminalize homelessness at the local, regional, and national levels. We will also leverage the strength of our volunteer base to support this cause. In times of economic uncertainty, charitable donations may decrease significantly. Additionally, economic downturns can lead to a decline in volunteerism. The Way Home is vulnerable to a reduction in volunteers due to our reliance on them for some of our services. During such times, volunteers may have to focus on paid employment and may not have time to offer their help. Finally, we may face increased demand for services as more people face unemployment and poverty rates rise. Coupled with the potential reduction in donations, this is compound financial strain. To navigate economic downturns, our organization will leverage the diverse expertise of our staff, which includes individuals with experience in grant writing, social work, budgeting, and direct work with the unhoused population. Further, the Way Home will actively pursue funding from a variety of organizations and grants, such as the Bill and Melinda Gates Foundation and the Missouri Valley College Foundation at the local, regional, and national levels. This strategic approach aims to mitigate the impact of economic downturns and periods of reduced giving. It will also address the challenge of limited financial resources, particularly since the Way Home does not charge for transportation services. We face limited financial resources due to the challenges of securing funding in a competitive nonprofit environment. To address this, the Way Home will implement strategies such as remote and community-based work for employees to eliminate the need for office-based expenses. Additionally, we will pursue sponsorships from Powerhouse Community Development Corporation, a faith-based organization in the community, as well as the Ford, GMC, and Jeep dealerships in Marshall. Securing a sponsorship for one of our vehicles would reduce the costs and preserve financial resources for expanding our services to the unhoused population. Finally, to mitigate the impact of limited financial resources, we established a partnership with Missouri Valley College's nonprofit management program. This partnership will allow interns to contribute their time to our cause, raising awareness and aiding in the development of future nonprofit managers who may wish to join our organization later as we expand. Another weakness the Way Home faces is transportation efficiency and reliability. Weather, rural terrain, and vehicle repairs could impact our ability to provide a reliable transportation to those we serve. Snow, ice, and flooding can make roads impassable, disrupting transportation services. We will provide flexible rescheduling during these times when our services are disrupted. Further, we will use 2 vehicles so we can still provide services when repairs are needed. We will also be proactive with repairs by completing regular maintenance on the vehicles. Finally, we face a low acknowledgement of need. Some individuals may not fully understand the complexities of homelessness, including its causes and impacts. Additionally, individuals may fail to recognize the benefit of our services in the community. To address this issue, the Way Home will implement educational programming within the community, including lunch and learn events hosted in local businesses. As mentioned earlier, we will also mobilize the community through forging partnerships with local organizations and conducting outreach efforts to address stigma and misconceptions surrounding homelessness and transportation services.
Now, speaking about the logic model, this is going to be a visual way to show the resources we will provide and the activities that we will have for the way home and the outcomes that we hope to achieve with our service. As far as resources go, we will start with 2 fleet vehicles. Our staff will include 2 community outreach coordinators, 1 administrator, 1 case manager, and this will be the person who is deciphering through the referrals, 1 Missouri Valley College intern, 2 drivers and volunteers as available. We will have partnerships and sponsorships with local and national organizations. Some of these include the Missouri Valley College, Marshall Public Schools, Marshall Police Department, the County Health Department, and over 30 local churches in our area, as well as the Missouri Children's Division. We will be getting funding through primarily grants, fundraisers, and donations. Our grants, as we have already spoken about, will be the Melissa and Bill Gates Foundation, the Buckner Foundation, the Missouri Valley College Foundation, and we will receive the donations and fundraising through various events that we will hold. And we are hoping that we will also get a sponsorship through Marshall's Ford, Chevrolet, and Jeep corporations. We will also need fuel and maintenance to keep these vehicles reliable and safe. As far as our activities go, the main one obviously be providing the secure and reliable transport that will be scheduled through the referral system. We will have to train the individuals to provide this transportation to the unhoused community. And we will be working with other agencies within our community and partnering with them to provide these resources, as that is where our referral system will begin. We will continuously be assessing the community needs through our surveys and feedback. Primarily, the surveys will be going to the people we are serving, either through paper or an online system. But we will also be providing these surveys through the organizations and local communities as well to hear their feedback. We will have case management to assess the referrals and schedule the transport, making sure to prioritize the need. And we will also be doing the fundraising events to aid in our cost, as it is free to the community. Our ultimate output is increasing the access to the resources that are already available to the unhoused community. We will be educating our community that through providing this transport, we are actually aiding in change for their lives, and they are able to get the services they need by having this transportation. We will help others understand that change can be made for the community by helping provide this transportation. We will also be decreasing the number of unhoused individuals through our service. Some of the outcomes we have short term are ultimately increasing the awareness of the resources that are already available in our community but are not accessible. The referrals are going to be assessed and accepted and able to lead to that secure transport. Understanding the impact of the transport, not only for that unhoused individual, but for the community and the people within that community. Our intermediate goals are to provide at least 15 individuals or families with consistent rides within the first 6 months. This kind of goes back to what Barb spoke about with having 38 individuals and families as a statistic. Unfortunately, we don't know if that is the primary number. That is what we went off with. And these are consistent rides, meaning taking them to get food consistently, going to a job, making sure they meet at their appointments. We also will be connecting with those local organizations to fundraise and increase access to our services in order to expand our services, which will lead to a longer term goal, which is ultimately to reduce the homelessness 50% in the area, Marshall, Missouri, with the help of our service. We can do this long term by gaining more access to vehicles, which will lead our vehicles to go farther out. As of right now, we would like to stay in the Marshall area, but hopeful to expand that. The more vehicles will obviously require more staff to navigate those vehicles. And our goal would be to help aid in reducing homelessness twofold by also offering positions within our organization. We would be hopeful that with more staff, we would lead to more urgent cases that would not need a scheduled referral. And there are going to be some assumptions that the Way Home has to take into account. The primary one being that the unhoused desire the access to these services in order to exit their state of homelessness. Another would be the resources available for us are in the reasonable distance that our fleet vehicles can get to, and it's safe and appropriate. And ultimately that the unhoused will utilize our transportation service as intended through the referral system. We could get some backlash for this as where, a referral is not accepted or we are not able to go where they would want to go. And we also would have to assume that our local agencies are going to work with us in making these referrals, as that is where we are starting. Finally, the biggest piece, since our transportation is free, we do have to look at the grants and the funding. We would have to assume that we do get those grants and we do have donations in order to sustain our service. There are also many external factors. The biggest one with transportation being geography. We have to consider weather conditions, rural roads, and the infrastructure that goes around that. But also what we've already touched upon is the preconceived notions and the stigma towards the unhoused community, especially in the rural areas, and just hopefully gaining the community support to provide this service. Now to speak about our plans and goals. Ultimately, we are hoping to decrease the number of unhoused individuals in Marshall, Missouri by 50%. Again, this is looking at the numbers we spoke about previously with having 38 individuals / families up to 100 people. We are measuring this in threefold by providing, advocating, and collaborating. Ultimately, we are providing the transportation to 25 individuals by the 1st of January of next year. This can be individuals, family, and again, we are hoping this is a consistent transportation service, whether that is getting the food they need, going to a job, getting to doctor's appointments. We need to advocate for the unhoused in the Marshall community by attending events. We would like to do this within our first 6 months to really speak about why transportation is such a barrier and how we are helping aid in that. Then we would need to collaborate with at least 3 other organizations and agencies. We are going to want to do this pretty early on, as this is where our referrals are going to be taken into account and then sent to us.
Our project will ultimately need community support. Without this, the stigma of homelessness and other populations who struggle will never end, nor will those come out of their situation with dignity. Funding through large grants and community donations will be most important in how the Way Home can sustain itself. Once the Way Home can secure community partnerships and thrive through yearly standing revenue, our nonprofit will slowly be able to grow while not having to rely on large grants, which may change or become unattainable from year to year. We will always need community donations and support. We will look forward to having local fundraisers such as chili cook-offs and other community engagement events in the near future, not only to thank those in the community and to collaborate with outside agencies, but to also raise additional funds and continue to spread awareness. To get our nonprofit started, we looked at many grants available for us in the Saline County area. We centered on 3, which we are confident we will be receiving. The Bill and Melinda Gates Foundation is a yearly grant of $27,000. The Buckner Grant is awarded at a $50,000 a quarter with $200,000 yearly. We will also be awarded the Missouri Valley College Foundation of $50,000. We will also be partnering with this local college for an internship as an in-kind donation. And the Way Home is very excited to also provide mentorship for a student completing their degree in nonprofit management at Missouri Valley. We will also be partnering with Powerhouse Ministries and receiving a $10,000 donation as well as a few other private area donations for a total of $30,000. Our total income with grants, donations, and an in-kind time donations will equal to $252,000. Our expenditures for the Way Home are broken down into staff salaries, benefits, and expenses. We research salaries for nonprofits through ZipRecruiter, Indeed, and Salary Guide. We wanted to be sure these positions offered a livable wage for the Saline County area, as well as to be able to retain employment for these positions. We will have one administrator for the Way Home with a salary of $50,000 or $24.03 an hour. They will hold an MSW and their benefits will include 3 weeks of annual leave and 10 sick days. We will have one case manager with a salary of $43,000 or just over $20 an hour. They will hold a BSW or greater, and their benefits will include 2.5 weeks of annual leave and 7 sick days. We will then have 2 community outreach coordinators, and they will have a salary of $40,000 or $19.23 an hour. This position will include the 2 drivers and staff. They will also be trained in crisis management and hold a Class E license in Missouri. Both of these will hold a BSW or greater, and their benefits will include 2 weeks of annual leave and 5 sick days. The total yearly staff salaries will equal $173,000. We also wanted to be able to provide an attractive benefit package to our staff to also aid in staff retention. This includes medical and dental insurance, and this total was based on the Department of Labor's McNamara-O'Hare Service Contract Act prevailing health and welfare fringe rate of $4.80 an hour. We calculated our staff hours of 8,320 hours with 4 employees at the health and welfare rate to come up with a $39,936. Our staff will be given 10 major federal holidays at the hourly rate which will equal $6,640. We have already discussed each staff's positions paid annual leave and sick leave, and based on their hourly rate for the year, this comes up to $11,239 and $4,618 respectively. While our community outreach coordinator's main duty is to transport clients, there will be times that our case manager and administrator may have to as well. Therefore, they will also hold a Class E licensure. This is a 3-year license at $21 for each staff member, totaling $84. We also guesstimate staff development to be around $1,000 per staff member for a total of $4,000. Next, we come to our expenditures. Our transportation service will, of course, be our largest overhead, which isn't too surprising as this is the base of our nonprofit. So by registering our business, we plan on leasing 2 vehicles through the U.S. General Service Administration, or GSA. Our first fleet vehicles will be 2 4x2 SUVs at the current 2024 government fleet rate, which is $261 per month. For 2 vehicles will be $6,264 a year. Vehicle maintenance may vary, of course, and we utilize a basic formula from fleetforum.org. So that cost will be approximately $1,753. We use the current petroleum rate of $3.41 an hour. I'm sorry, $3.41 a gallon, and that was on March 11th of 2024 to calculate future petroleum rates. We guesstimate that each vehicle will travel 250 miles per day, 5 days a week for 52 weeks a year, which is 130,000 miles per year, and our average miles per gallon for our vehicle is going to be 22 miles per gallon. So we will calculate our petroleum rate to be just under $6,000. We did not include a cost for vehicle insurance as our Class E licensure requirement is paid as an employee benefit. Our fleet vehicles also require personal insurance as well. So for vehicles, maintenance, petroleum, and insurance, we are calculating just under $14,000. Our next set of expenditures is for our day-to-day operations. This includes outside storage and parking for our SUVs to transport clients at $960. Phones, internet, laptops, a subscription to Microsoft 365, printers, and other office supplies will total just under $13,000. A large expenditure will need to be Wi-Fi hotspots, as our service is in a rural area and we may not have much internet and phone coverage. We also plan on working from home to reduce rent and office space. We are proposing approximately $1,000 for marketing. Our referral systems will require collaborations with other companies. This also allows us to afford some food and drinks for our lunch and learns that we do plan on having. Our nonprofit startup costs and other miscellaneous legal fees are calculated to be at $1,200. Finally, our accounting and tax fees are roughly $3,000. So our total expenditures will equal $268,325 for the first year. After our total inputs of $352,000 and our expenditures of $268,325, our proposed standing for our first year is projected to be approximately $83,675.
The why. The story behind No Way Home, or The Way Home. Sorry, guys, I'll change that. While working with the unhoused individual, he and I began talking about how he got here and if he cared to share his story with me. He told me about how he had a good job and he was doing very well when his mother became ill. He moved home immediately to help with her care. When she passed away, he was kicked out of her apartment and was forced to live with his significant other that was abusing him. When he was forced to leave that situation, he said he ended up on the streets with nowhere to go and no transportation to help him to and from necessary community resources to aid with his situation. He looked at me and he said, "Miranda, if I had transportation, I could get back on my feet. I would have a way to a job that didn't require me to walk there and back, sometimes miles to and from work. Then," he said, "I also have to hope that no one steals what I have worked for while I'm gone." He said I could travel to take a shower and have a place to stay at night out of the weather. He said I could get myself to and from doctor's appointments and vet appointments for my emotional support dog. I just feel like life would be a little easier with some help. This sparked the idea for assistance with significant need in rural areas of Missouri. These are ways that we can aid in bettering the lives and conquering the barriers of unhoused individuals. A community holds more power when we are collaborating together for the benefit of all. What can we do to take the burden off of those who are struggling? The Way Home offers safe, reliable transportation from someone who is empathetic, doesn't judge yet understands, and can offer access to other needed resources. Join us as we create safety, dignity, and an opportunity for those in need. Thank you.